welcome back to another anatomy video. This is Dr. Aiyan from the Veterinary Anatomy channel. In this video we will learn which muscles should we cut to be able to remove the forelimb, and we will dissect some of the deep shoulder girdle muscles. So let's get started.
Okay guys, today and now we will remove the forelimb completely from the body, and to be able to do this, of course, as we discussed before, there are some muscles which connect the forelimb to the trunk. We need in this case to cut these muscles. But now let's refresh our mind about what muscles should we cut really to be able to remove the forelimb completely from the body, and I will keep these muscles just for now. The first muscle we need to cut is actually the trapezius muscle, which inserts, of course, to the spine of the scapula. We already cut it here, and now we can reflect it up. The second muscle we have to cut is the isthmus dorsi, which comes from the thoracolumbar fascia to the medial surface of the humerus. We cut it at this level here, and we will reflect it up and down. Okay, that isthmus dorsi. The third muscle we have to cut in this case is the brachiocephalic muscle, yeah, and I will cut it at the level somehow of the clavicular tendon. Okay, so we cut this muscle. Now we can reflect it up and down, up and down. Okay, now in this case we keep just the cleidobrachial muscle here with the forelimb. Now the other muscle we have to cut in this case is the omotransversalis muscle, from the atlas again to the chromion. So we need to cut it in the middle, so we will cut it at this level here, keep part of it on the forelimb and part of it of the skulls, and we can reflect it up and down. Okay, what else? Now I need your help, guys. So what muscle we should cut to be able, I cannot remove it, I still cannot remove it now. Okay, yeah, exactly, the rhomboideus muscle. Connect also the forelimb to the trunk. We need also to cut the rhomboideus muscle. In this case, remember that the rhomboideus muscle has two parts: the thoracic part of the rhomboideus muscle and the cervical part of the rhomboideus muscle. We need to cut both of them. I will cut them somehow in the middle here. So just like this. So I already cut the thoracic part. Now I need to cut the cervical part. This one here. I will cut it also like this. So it's already cut, and we can also later dissect it and reflect it upward. What else, guys? We still cannot remove the forelimb completely. In this case, remember firstly that we have the pectoral muscles. The pectoral muscles, of course, in this view, it's not easy to show the pectoral muscles. I would like just to make it like this. Okay, I don't know if I'm in the focus now, but I will show you that here we talked about the superficial pectoral muscle, if you remember, which has two parts, the transverse pectoral muscle and the descending pectoral muscle. I need to cut both of them, and I will do this just in the middle here. Okay, after I cut the superficial pectoral muscle, there is another muscle here. Can you see that? It also connects the forelimb to the sternum in this case. This here is the deep pectoral muscle. I need also to cut the deep pectoral muscle somehow, and I will cut it now. And so slowly the forelimb is more movable, but again, I'm still not able to remove the forelimb completely. Why? Do you remember any other structures we have, or let's say any other muscle we need to cut before we remove the forelimb? Yes, exactly. As you can see here, this muscle is also there to connect the forelimb or the scapula to the trunk. What is the name of this muscle? This is the ventral serrated muscle, which has two parts, the thoracic part here and the cervical part here. Both of them are connected to the scapula. Now, to be able to remove the scapula, I need to cut this muscle. And before I do this, I would like also to show you something else. I show you all the branches, all the nerves of the brachial plexus. Can you see them there? And I will let's do it this way. I will cut now the cervical part of the ventral serrated muscle, Stay with me just a little. So this is the cervical part of the ventral serrated muscle. Okay, cut it. Okay, and now can you see that? Can you see these structures here? Very nice structures. They are actually the branches or the nerves of the brachial plexus. The nerves of the brachial plexus, okay? Of course, they come from the spinal cord, from the spine, for the innervation of the muscles of the forelimb. That means they also connect the forelimb to the body. So if you want to remove the forelimb, you have to cut off all of them. Not only the nerves, but also this artery. Can you see this artery here? This artery, very nice artery here. This is the axillary artery. This is the axillary artery, which comes from as a final branch or a continuation of the subclavian artery from the thorax upward here, and moves and supply the forelimb with blood. We need also to cut this. We have also in the depth there the axillary vein. We need also to cut it. Okay, but before we do this, I may think about providing a short video about this nerve. So let's just go backward and cut now the thoracic part of the ventral serrated muscle, and they will cut it at this level here. Now, after we cut the cervical and the thoracic part of the ventral serrated muscle, guys, the only structure still there to connect the forelimb to the trunk are these nerves and arteries. Can you see this nerve? Can you remember the name of this nerve? Or this is another nerve here. This is the long thoracic nerve to supply the ventral serrated muscle. So I will go through the nerves a little bit now here, and after that I will cut them and remove the forelimb completely and start dissecting the muscles here. Before I do this, I believe I forgot to talk about a very important structures before we remove the forelimb. In front, guys, in front of the scapula, just in front of the scapula, in this area, I dissected it. It was like embedded inside like a fat. Back here, this structure called the suprascapular lymph node, or in the anatomical word of it, the superficial cervical lymph node. This one here is the superficial cervical lymph node, or the prescapular, they say the prescapular lymph node. That's also okay. This is one of the most important lymph nodes we have, for example, to check in slaughterhouse to see if there's any problem with the goat or sheep or other animals like bovine or whatever here. So where the location just in front of the scapula, somehow the distal part of the scapula in this area is always there, called, what is the name? The prescapular lymph node, or the superficial cervical lymph node. Okay? Okay, guys, I will work on this and come back to you very soon. See you later. Okay, guys, as we said before, we dissected a little bit the branches, the nerves from the brachial plexus. So here we can see how the brachial plexus really gives actually in total 12 nerves to supply, or to innervate, of course, to innervate not only the muscles of the forelimb, but also the some of the muscles located in this region, like the pectoral muscles, for example, the ventral serrated, the cutaneous trunci, and all of this together will be also innervated by branches from the brachial plexus. So we clean some of them here, and later we will try to explain every single one and the innervation area. I just want to show you actually, before I cut them and remove the forelimb, how they really contribute to the forelimb. Not only them, of course, here we have, as we said before, the axillary artery also supplying blood to the forelimb. Here, I would like really to mention also something very interesting, very important. We talked about the prescapular lymph node, or the superficial cervical lymph node, located just in front of the scapula in this area here. So don't forget this one, guys. It's very important. At the same time, on the medial surface of the scapula, or the shoulder joint in this case, just like this, we can find another very nice, small, cute lymph node located just medial to the shoulder joint in this region, called the axillary lymph node. So this is the axillary lymph node. It is like small here and small ruminants. We talked about the axillary lymph nodes in other animals. If you remember, in carnivores, we say that this is also like important and responsible for the cranial and mammary complexes. Good. Here, after we moved the forelimb to the side, again, let me just show you just in this region. So we talked about the shoulder girdle muscles there, but here show you what we cut regarding the pectoral muscle. So we cut the superficial pectoral muscle and the deep pectoral muscle. The superficial pectoral muscle, both parts, the transverse and the descending parts, or pectoral muscles, or the transverse and descending parts of the superficial pectoral muscle, this one here. And here we cut the deep pectoral muscle, which, as we said before, originate from the sternum there and inserts to the greater and lesser trochanter, greater and lesser tubercles of the humerus. Okay, so that's what we can talk about in this area here. After we move the forelimb to the side and all the muscles which we cut, this is the part of the brachiocephalic muscle, this is the omotransversalis muscle, latissimus dorsi there. Here, for example, the one here, of course, if you remember, this is the trapezius muscle. We cut it, dissect it, and move it up. And this is the other muscle, the rhomboideus muscle, which we also cut with the thoracic part and the cervical part. Now we dissected this muscle and move it to the side also. Now we can see the knuckle ligament here in this area here. Of course, the knuckle ligament in this area, but the ligament we can see on the top of the spinous process of the thoracic vertebra. We name it as supraspinal ligament. Here, we talked about the ventral serrate muscle, but now it's really very clear after we remove the forelimb completely. Remember, we said that here we have the ventral serrate muscle, thoracic part, and the cervical part, both inserts to the serrated face of the scapula. Yes, now after we move and cut and remove the forelimb, now we have a complete view of this muscle. So again, this is here the thoracic part of the ventral serrated muscle. Look, it inserts, originate from the ribs, as you can see, different location. And here we have the cervical part of the ventral serrated muscle, coming and originating from the transverse processes of the cervical vertebra. So if you look here, for example, here we have the atlas axis, and so on backward the rest of the cervical vertebra. In this case, you will see that the cervical part of the ventral serrate muscle originate from the transverse processes of the last few cervical vertebra, this area here, these processes here, okay? And of course, moves for and inserts to the serrated face of the scapula. Of course, according to the origin and insertion, you will find that this muscle has a great function. First function, of course, as a shoulder girdle muscle, is to fix the forelimb to the trunk, of course, and that's why we were not able to remove the forelimb because it was connected to this muscle, and we had to cut the muscle to be able to remove it. So this is the first function. The second function is because of the origin insertion again to the ribs, for example, contraction of this muscle. If it depends on the position of the forelimb, of course, can move the ribs outside or away from the midline of the body, increasing the volume of the thoracic cavity and helping with the inspiration. Of course, look at the origin and insertion. Of course, you will understand the function of the cervical part of the ventral serrated muscle and so on. Now we'll move it to the side here, and before we move forward, I would like to show you this muscle here. This muscle here, this is the scalenus muscle. It's really very thin in this goat here. I will try just, can you see that? This here. This is part of the scalenus muscle. As we learned before, the scalenus muscle normally has three parts: the dorsal, ventral, and the middle. In carnivores, we had only the dorsal and the middle. As you can see here, it originates from the lateral surface of some of the ribs here and inserts to the transverse processes of the last two, three. That means C5, C6, C7 transverse processes. The same for the middle. It originates the middle here, middle part of the scalenus muscle originate actually in this case from the first rib. This is the first rib here under my finger. Can you see? Yeah, it originates from the first rib and inserts also to the transverse processes of the cervical vertebra. What else I can see here? Another muscle actually, which I would like also to mention. This one is a small muscle, originate from somehow the lateral surface of the ribs number 3 and 4 here, and from the sternum, and moves just here and inserts to the first rib. This muscle called the rectus thoracis, or the straight muscle of the thorax. You can dissect it a little bit there. So you will find that it's really very small muscle. It's really very small muscle located in this area here. Let me just show you. If you continue the tendon of this muscle, you'll find it continuous as the straight muscle of the abdomen, which we are going to talk about later. According to the origin and insertion of this muscle, the rectus thoracis, or the straight muscle of the thorax, so contraction of this muscle will also move the ribs a little bit, or these ribs at least, a little bit away from the body. Away from the midline. That means increasing the volume of the thoracic cavity, and that's why this one here, this small one here, left and right, of course, it's an inspiratory muscle. This is an inspiratory muscle. Okay, what else here? If we move upward here and reflect or move the ventral serrate muscle down, guys, we mentioned, in previously, the dorsal serrated muscle, if you remember. So this one here, so we say that here we have this small muscles, they call the dorsal serrate muscle, and because we have another one here, so we named this one as the caudal dorsal serrate muscle, and this one was the cranial dorsal serrated muscle. Okay, and we were not able to see that before because it was covered by the scapula, as you can see here. Okay, so once we remove the scapula, now we can see this muscle. It's really very, very, very thin, especially in this goat. I don't know what to do actually, so I will just try to put the forceps just under the tendon of this muscle and show you, can you see this muscle here? So it originates just from the ribs at this level here and moves in this direction, in this direction, inserting to the supraspinal ligament and to the median ruff in this area here, or to the fascia in this area here. This one here is called the cranial dorsal serrated muscle. In other animals, it's more developed, of course, and it has also like teeth shaped in this area here. So this is the cranial dorsal serrated muscle. This is the caudal dorsal serrated muscle. If you remember, we said that according to the origin and insertion of the caudal serrate muscle, caudal dorsal serrate muscle, we decide that this muscle is an expiratory muscle, while in this case here, look at the origin and insertion of this muscle. So contraction of this muscle it's supposed to, in this case, move the ribs away from the midline. That means this is one of the inspiratory muscles. So, and it's mentioned as inspiratory muscle on all books, you know, the cranial dorsal serrate muscle. So in this view, in this case, guys, look, I will just keep it like this. So we can see all serrated muscles, including the ventral serrate muscle, because it's more ventrally. Ventral serrate muscle, 2 parts, cervical and thoracic. Dorsal serrate muscle, 2 parts, cranial and caudal serrated muscle. Okay? Okay, guys, what I'm planning to do is to remove more from, you know, of these muscles a little bit, to be able to maybe show you the intercostal muscles.